welcome back to another episode of Be Enrich Your Journey podcast. I'm your host, Patrick Monahan, partner, senior wealth advisor with Trilogy here in St. Louis. Thanks again for being here on another episode. Really excited for this topic today. I've got a friend of mine, Adam Berkowitz, with us today. This episode really is geared towards business owners, particularly small, mid-sized business owners. We're going to be talking all things health insurance today. So we're kind of keeping it light. Got some interesting stats. Definitely want Adam to tell his story. He's got some amazing things going on with his company/companies. Just rolled out a second one, so we'll get into that a little bit. So why don't we get started? Thanks for being here, Adam. Appreciate your time.
Thanks for having me.
I'm going to start. You all know I typically love sharing stats. So I think the theme for today really is, the health insurance world is a mess. Is that fair?
It's a mess.
For lack of a better term. It's very complicated, convoluted. There's trends that are bad. There are trends that are some trends that are looking good. So I always like to start just kind of level setting with where we are. I just printed out some information to kind of set up, again, where we are with health insurance, and then we'll dovetail into Adam and what he's got going on. So I found this study. This was done by Mercer Marsh Benefits. It's it's for 2024, so this is very current. They surveyed 223 insurers. This is actually a global study. And here's some of the main themes that they found across the board. So over half of markets are facing double-digit cost increases. Pretty crazy. And we hear this a lot from clients, business owner clients, that the continued theme of, they get their renewals at year end and they're seeing the double-digit increase in premiums. It's a massive expense for the business. And it's always, why is this? What else can we be doing?
Right.
Seems like it needs to be more innovative. So we know that's an issue. Health systems are undergoing transformation as they face disruption from skill shortages with digital healthcare. That's a kind of a buzzword right now, hearing a lot more about that. Insurers are responding to the need for cost containment, providing options for employers to make plan design changes. I know we'll get into that. That's a very interesting one. And then there's still some gaps. Mental health, women's health, inclusive benefits. There's still some gaps that continue to persist there. I mentioned the digital health one. Seems like it's very much still in the infancy stages. Mm-hmm. Again, this is on the study here, but it says of all these insurers that were surveyed, it's really a mixed bag on if they believe that there'll be an impact by digital healthcare. It says 22% believe costs have decreased due to digital healthcare. 55% say no effect at all. And 23% actually believe that it's gone up. So not really a clear outcome on the impact of digital yet. Yeah. And I know that's pretty early. Just a few more here. I mentioned mental health, another issue in the trends. The least 3 covered mental health benefits. This is globally, again, 224 insurers. Alternative mental health therapies, this is not covered. 41% not covered. Substance use, abuse treatments, 35% across the globe not covered. And then big one, almost 30%. Virtual advice via chat, so a non-human involvement for anxiety, sadness, depression. Again, 30% of those do not offer that. But there are some positive trends, right? So factors with the greatest transformative impact on employer-sponsored healthcare cost. Again, AI for the first-time diagnosis, 70% believe that will be a positive impact. Mm-hmm. Advances in remote patient monitoring, 64%. Pharmaceutical development, still a large one, 61%. Reduced reliance on public healthcare plans at 30%. And then genomics, personalized medicine at 28%. So it seems like, there is the good, the bad. I don't know really what the ugly is, if you will, but
yep.
There's a lot of movement in the health insurance world. I just wonder, again, for level setting, where you are, bring us up to speed with where the market is, and then would love to get into kind of what you're building, which is super inspiring.
It's my pleasure. So what's unique about our industry is that this is a pretty universal but also uniquely American problem, right? The cost of healthcare. Pretty much every American business is struggling with this this issue because it's a top 2-3 line item expense on the P&L, and it's only getting worse, right? So you said the double-digit increases, this is happening. And for the last 2, call it 3 decades, what's been the number one strategy as costs go up? Shift it onto your employees. So higher deductibles, higher copays, higher premiums. So you're paying more for less in healthcare and health benefits year after year after year. So we're at this point where we're probably already off the cliff. It feels like we're headed towards this really unsustainable trajectory of how do we keep doing this?
Sure.
And so, it dawned on me probably about a year ago how we view health insurance as this thing that we all buy into, all of us, since birth, participate in this thing to provide financial protection in the event of a catastrophic loss or something unexpected. And yet it's not really doing that, right? How many people have $3,000 lying around to pay their deductible? And that's the average deductible, by the way, $3,000. How many people have $3,000 sitting around?
Yep.
CNN did a study last year, I think, that said 40% of all Americans have less than $1,000 in savings, right? There's no surprise to you.
No, we see that with just emergency funds, right? Like it's not there.
It's not there.
It's scary.
And so this thing that we're all paying into, that we're all participating in, isn't providing the protection it's sold to do. That's a problem.
Right.
And it's probably making the problem worse because there's more medical bankruptcies than any other type of bankruptcy, and most of those people had health insurance. And so when we view healthcare, or let's just say health benefits, as employee money, this is compensation. So the more dollars going towards that, the less money going into your wallet. That's a huge problem.
Right.
And so we came at this and said the typical strategies, the typical approaches, they're not working. We need to completely rethink how we're delivering benefits from a care perspective, because the biggest problems are there's no transparency in what things cost. What is the quality of the care that we're getting? Is it even necessary health care? And who should pay for it? I mean, these are all like the big problems.
Yep.
And so when we look at typical strategies of just raise your deductible, go to an HSA plan, or go to a narrow network plan, we're just moving dollars on the table. We're not actually changing the economics that drive what does an MRI cost? What does a knee surgery cost? That's what we're paying for.
Right.
So we start to think about it in those units of like, okay, the unit cost of care has to be impacted, and what are we overspending on, or what are we spending on that we don't even need in healthcare? And now we can start to really bend the curve if we think about it from that type of perspective.
So I should have, backing up, done an intro. So you started a company to solve these issues, right?
Yeah.
So walk through founders, president of Simpara.
Yep.
What is Simpara? What's the main mission that is involved with your daily mission of really solving a lot of these issues, right?
You got it. So we started this business 2016, so 7 years ago now. And it was really, I've been in this business ever since graduating college, kind of on the broker side of benefits industry. And the joke is once you're in, you don't really get out. And so I enjoyed the work, but it was what I would call kind of typical status quo brokering. And it was when our first son was born in 2016 that I'm seeing a firsthand experience of our medical system and all the issues that happen. Think of anything else that we consume that if the service is messed up, or there's an issue, or you buy a product and it's defective, you return it, right? But in healthcare, if they mess up, we pay twice.
It's crazy,
right? So
think about car buying or home buying, some of the things that affect us on a daily basis, even retail, like you said, clothing. I mean,
yep.
Your health, I would think, supersede. I mean, it's more important than all that,
Right.
And the transparency issue that you're talking about, it's pretty daunting. It's hard to understand.
It is, and it feels like, okay, that doesn't happen to everybody. But the third leading cause of death in this country is medical errors, avoidable, preventable medical errors. And so when our healthcare system messes up, we have to go back in for a revision or another procedure. Guess who gets charged again? We do. And so, we had this experience, this very personal experience when our son was born. And I remember the doctor told my wife, this should not have happened. This could have all been avoided. And that really pissed me off. Yeah. And I was like, man, I know a lot about our healthcare system. I've been in this industry for a long time. So what can I do to maybe make a small dent in this picture, to maybe make it a little bit more appealing, affordable, make the care better? And so we started thinking about how do we deliver health benefits as the gateway to healthcare, right? We're not clinicians, so don't pretend to be. But it lets you view benefits as the way into our healthcare system and financing our healthcare system, and how do we make it better? And so that's kind of the thesis of why we started this business.
Very interesting mission statement.
Yeah.
You know, and passion. And every time I've met with Adam, we've known each other for probably 10 years.
Yeah.
MIZ grad, shout out Tigers. But every time we've met, the passion, you exude passion and on what you're trying to solve, which is all these issues, really. This sort of, I think of it as like, there's so much going on that's costly and to the billions of dollars, like behind this curtain that nobody really sees, right? And so I think what you're trying to do is solve that in a way that's scalable and almost like a turnkey, right? Like that you can bring this to market. It sounds like you're doing that.
We're doing it. It sounds like we're trying to scale Mount Everest. The reality is it's really not that hard. When you start applying transparency to things like this, when you could fix what you can see, it's really not that difficult. What's difficult is fighting the inertia of doing nothing and trying to get employers to move and say, that's a better way to do it.
Yeah.
Right. So when I say it's not that hard, there's really two main drivers of cost in this industry. One is what we pay for healthcare is inflated dramatically. I mean, it's probably 3 to 10 times overly priced. And it's been that way because we can't see the prices. And we have massive vertical integration. I like to give the example of the third biggest pharmacy in the country is United Healthcare. We don't think of United Healthcare as a pharmacy. We think of them as an insurance company. But the company that's insuring our risk is the same company filling your medications and the same company dictating the price of those medications. So it's left pocket, right pocket. And all of our money is going into this huge complex, and it's just making it more expensive.
So how do you go about, this is obviously a behemoth industry.
Yep.
You're starting this company at 2016. At how old? 7 years ago?
Gosh, 30. Yeah, 36 when I started, maybe 35.
So you start in a massive multi-billion-dollar industry and say, I want to fix this, right?
Yep.
That's, pretty cool, right? So how, fast forward to today, you now have multiple employees across the U.S. How are you? Give us examples of what you're doing, how you're doing it, and then also like what your market, what your clients look like.
Sure. So, I mean, our typical client size, typical client profile is privately held, multi-generational, family-run business, and generally in the manufacturing sector. That's kind of been our bread and butter since we've launched. It seems like there's an appetite for change when you have these leadership transitions to do something different. But you also have a workforce that is really sensitive to price. A $20 copay for medication could prevent that person from getting that medication. And so almost all of our plans don't have deductibles anymore. Almost all medications are free. Primary care is free. Mental health care is free. I mean, so we're doing all of these things that seem counterintuitive. It's actually bringing down the cost of care. So we just took the model and we turned it upside down and said, this is a better way to deliver healthcare. And it benefits the patient, benefits the company. And of course, we're making a profit doing it. We're not,
Right.
And yet we're still saving all this money.
And obviously creates a loyal employee if they can't get that, if they go to the manufacturing company down the street and they don't have the same model. So, but let's play that back 30 seconds. You just said preventative care is free. For the most, I assume we're, kind of generally speaking, but majority of your plans, is that fair to say?
Pretty much all of them.
Pretty much all of them. Preventative care, mental health care, and prescription.
Yep.
So, if you're
most of our plans don't have deductibles. So like surgeries and hospital care can be free too.
So
it's crazy.
If I'm a business owner and I'm watching this right now and I just heard that, how the hell did you? I don't understand this.
So there's like this aha moment of, okay, we've been moving to higher and higher deductibles for the last 2 decades.
A long time.
And yet when we get to renewal, we still see that 20%, 30% increase. So it's like, I thought we changed our deductible to avoid that. What happened? Well, we're not focusing on the cost of care. And so what we started to do was, when you look at the inflation, or I should say the markup of healthcare services, so like an MRI, think about at Barnes, that MRI cost probably $4,000 or $5,000 at the hospital. We can get that same MRI for about $300. It's the same equipment. It's the same service, right? So if you're going to insure both of those things, what's cheaper to insure?
Right.
It's cheaper to insure $300. And so if you look at the unit cost of care and you apply it across the entire spectrum of healthcare, and if we're spending 50, 70% less on the unit cost, well, insurance should go down, right?
Right.
It should follow.
Right.
So that's essentially what we did. We went to the health systems in our region. We went to independent practices in our region and said, if you give us a transparent and fair price based on actual cost, right? Based in reality, not some crazy markup, like give us a fair price. We'll give you a fair profit margin, of course. We'll send all of our patients to you through plan design incentives. So if they go to, let's think of an example. We work a lot with Mercy. If people go to Mercy Health, it's always free because we have a price there that's unbeatable in the market.
So that price is pre-negotiated with Mercy and that specific plan for that employer?
Correct. Wow. And we're not saying don't go somewhere else. I mean, we're very lucky in St. Louis. We have great healthcare. Right. We have great options. So we're not saying you can only go to Mercy, you can't go here. But patients need to know these are finite dollars and it's their money, right? Whatever we're saving in the healthcare is going to benefit everybody in the long term because that's more money in their paycheck, right? So you can go other places. It's just going to cost you more.
Sure.
It's still covered by insurance. It's just going to cost you more.
So, that's the employee or the patient's decision if they want to drive across town.
Right.
But that saves them 70%. They're the consumers of a plan. They have that.
When you say this is free and that's going to be $1,000, people are choosing free almost every time.
Even if it inconveniences you maybe a little bit, if it's a little bit of a further drive. Is this model, but this is, you mentioned the healthcare we have here, really in the Midwest, but specifically where you and I live in St. Louis. Is this model, I would imagine it's, repeatable. If I'm a business owner and I'm watching this in Florida right now,
it's entirely scalable.
This isn't just...
We have these plans across the country.
Okay.
Yeah, this model works. And from a provider standpoint, we get asked all the time, why would Mercy or put any hospital or doctor in there? Why would they accept a lower rate? Well, it's not hard. They're still making a profit, okay? And they're getting the full bill paid within like 10 days on average. If you ask the hospital what their receivable rate is on somebody with a $5,000 deductible, months, they're not going to get it. Yeah. They're not. These patients can't afford it, so they go on these 5 to 10 year interest-free payment plans, $20 a month, and they're not collecting it. And so we're saying we're going to give you the full bill in 10 days or less, but we just need to give us a fair price.
And there's a lot of value to the hospital system getting the money up front.
That's right.
The 0% interest.
That's right.
If they're leveraging any money,
that's right.
We go down that path right now. On interest rates.
And then if they sell the debt to collections, they're getting 80 cents, 20 cents to the dollar. Right. So if that
costs them a lot of administration costs, plus they're taking a haircut if they have to sell it off. That's such a bifurcated part of, I keep saying this is a behemoth industry.
No, it's massive.
But even the fact that, and I've been aware of that too, because, we have children too, and even just any higher expensive surgeries or any of our medical histories that we've had, my wife and I, they would say, how would you like to pay and for how long? That's just their initial question. I'm like, wait, what do you mean?
Wait, we talking about, I have insurance. What do you mean?
Do I fill out a credit app? They're like, no, you just tell us how much you want to pay for how long. Like that's mind-boggling.
Isn't it crazy?
It doesn't seem like that's
on top of all the premium you pay every single month.
In addition, right?
Yep.
But I'm very surprised that they say they know they're not going to get paid on that full amount.
That's right.
Well, majority of those, I would imagine. So, well, that's super interesting. So it takes you guys a lot of sweat equity. If a new business signs up for you, they're in a more, I'll call it archaic plan.
Sure.
Are you you mentioned putting it upside down. Mm-hmm. Are you custom tailoring and going to build out and renegotiating that for that specific company, or is it a lot of it already built up?
Because we've created this infrastructure, we aggregate it across our clients now and in the future, and so we just keep stacking on top.
So you got a lot of economies of scale because it's already set up.
That's right.
So if you're a business and you're concerned that I'm interested in switching because of everything you guys have just mentioned, the cost cutting, but we're not really losing benefits. Maybe we inconvenience employees a little bit if they have to drive a little bit further. But it's not going to take you 12 months to get this set up for us because you technically already have the foundations.
The infrastructure's there. That's right.
Got it. Okay. That's really interesting. Mm-hmm. What else do you see as, just going back to the trends we talked about, does technology, is there more opportunity to reduce overall costs, either in the more archaic way or even in the model that you have, leveraging technology that we're seeing in some of these studies?
Technology is interesting. I think, technology is not going to make people healthier, but what it can do is remove access and the barriers to accessing healthcare and probably bring down the cost of delivering healthcare. We're seeing that. We have a really unique primary care model, actually with the St. Louis-based company called Resilient Health. They'd be good for this show.
Okay.
They
Write that down.
Yeah, write it down. So we partner with Resilient across almost all of our client plans, and they act as what I would call like the central nervous system of health care, not sick care. And so we're not telling patients they have to switch their primary care doctors, but what it is an option to have access to on-demand primary care whenever you need it for no cost, whether you're at home, you're on the road, or you want to see them in person.
That seems like that's a massive time saver. People are traveling.
Yeah.
The telemedicine, just with technology, it's super convenient.
It's super convenient.
I mean, COVID, I think, probably increased that significantly. I haven't seen stats on that, but I have to imagine we were home for so long.
That's right.
Like being able to sit in front of your computer that has a built-in camera.
Here we go.
Talk to a doctor. It's pretty sweet.
Yeah, COVID, I think, accelerated a lot of this. People became much more comfortable with the idea of virtual medicine, but of course it peaked and then it kind of tapered back down. But what we're seeing with this resilient healthcare model is it's not your typical teledoc model where you call in and you're getting a random doctor. It's always the same doctor every time you call in, and these appointments are 30 minutes to an hour on average. I mean, your typical doctor time today is like 10 minutes.
Right, because they've got 30 people behind them and they want to leave at some point today.
Exactly.
Yeah, and that's a whole nother.
It's a different model, right? So, if we fix primary care, we provide really great upfront health care and lifestyle medicine, then all of these other downstream impacts, like you don't need urgent care. You don't need to be on these expensive medications,
Yep.
You don't need knee surgery because we're going to talk about diet and nutrition and things like that.
Yep.
So.
Do you see the average consumer of healthcare having access to more education too? It seems like, I know preventative care is talked a lot.
Mm-hmm.
There's wearables now. There's, technology. You understand your lifestyle. I even saw something here at genetic makeup.
Yeah.
As a potential massive part of healthcare. If you could have your genetic studies done and paid for you,
right?
Understand how you should live your lifestyle based on your genetics.
Yep.
It seems like the flow of information to the average consumer is, maybe it's not all at our fingertips yet, but it seems like it's
getting there.
A lot of momentum in that regard. And I would think that really all that is doing is leading up to more and better preventative care, which then should lead to a lower premium, I would think.
Yeah.
Because we're utilizing urgent cares and
keep people out of the hospital. I mean, that's the whole idea.
Do you see that being a major impact to continue to drive a better experience and outcome, but then also more affordable premiums going forward as well?
Yeah, I mean, I'm an optimist. I think that more information, more transparency about your health is a good thing. And I think the more people who are engaging in kind of that view of healthcare is going to be better long term. Because right now we view the doctor or the pharmacy as like the quick fix when I'm not feeling well.
Sure.
Let's focus on just living a healthy lifestyle up front.
One other question that came to mind is, when you go to the model what do you call the model you got, by the way?
So it's so we call this like a high performance health plan. It's a form of self-funding or I should say partially self-funding your health insurance.
Got it. Mm-hmm. The first question that every patient has when you're making a change is typically,
is my doctor covered?
What? That's right. That's exactly right. We've heard that in the past,
yep.
Right? With some of the healthcare.gov, that type of stuff.
Of course.
Does that change? Is that impacted?
Our view of this, I should say our philosophy of this is that we don't want that type of disruption. Adoption and embracing of a new model, you don't want to piss people off early. It has to be a really positive experience. So we want price to go down on day one. We want you to be able to keep your doctor if you want to. We want to provide better options if you're interested, and start getting people in and engaged in this environment. And okay, if you now want to see this resilient healthcare model and see if that's something that could work for you, usually people are like, that's pretty awesome. I will switch my doctor.
Yeah.
But we don't force it. We believe more of like the incentive model versus kind of the punitive, like, don't do this or you're going to get whacked.
Sure. I don't imagine you're doing consulting with them early on. You're going through a lot of these questions.
Oh my gosh. I think most of what we do is the change management aspect. It's like getting the pricing where it needs to be and reducing the cost of care. Like that stuff, we do that in our sleep. It's the change management, getting people to drink the water.
Yeah. I'm imagining you have some pretty loyal clients. If you've saved them, like you must have testimonies. Like what's the average, I don't know, you may not have this, but like ballpark premium.
Yeah. So,
and also what's your target for the audience watching? Like what is a target client,
sure,
from your company?
So national average cost of premium is about $15,000 an employee
Per employee
per year. Isn't that crazy? Wow. So in our plans, they generally range from $6,000 to $8,000. Now we have some that are higher, we have some that are lower, but that's kind of our average.
Gotcha.
So, we're probably anywhere from 30 to 50% less than the competition in the market. So you
love when you guys walk in.
And you think about this environment where competition for talent and low unemployment rates, interest rates are up,
right.
Margins are being pressed. It's like, where can we pull a lever? Healthcare is, it's at the top of the P&L. If we can reduce that 30%, that's massive.
It's right there at labor cost, which we know is 70, depending on who you look at, 70% of your overall cost as a business.
That's right.
It's right there.
And it compounds. It's year after year sustained savings. That's what's amazing about this. It's not like you get it in year one and then it goes away. It's like, no, this is sustained.
So do they all invite you on like their company trips?
I'm still waiting for that invite. No. We have very loyal clients, and the employees like, we're getting high fives and people are hugging us. I'm like, this is crazy. Like we're insurance brokers. It's crazy.
Awesome. That's cool. Well, that's very telling too, right?
Yeah.
That's a pretty cool testimony in itself. So let's transition. So that's Simpara. That's really completely, you call it rehumanizing insurance, which I love. So again, obviously massive potential on savings there, modernizing the plan, and we'll put all Adam and his company's information. And let's switch gears to your second company. I mentioned you just started a second company. Pretty excited. Congrats on that.
Thank you.
I saw the news outlet on that, or the news.
Yeah, Biz Journalism.
So talk to us about what that is and what you're building there.
So we launched Level Health like Q3 of last year, so 2023. And the whole idea was, how can we enable greater adoption of what we're doing on the Simpara side of the house? So it's very, our work is very custom. It's one employer at a time. It's very human capital intensive. And, we want to de-risk adoption and make buying and selling this type of health plan as easy as, say, buying United Healthcare, right? Because that's very easy to do, right? In fact, companies could probably go online and buy UHC for their small company today. So what if we made it that simple? We took all of the concepts and all of the infrastructure that was working really well, and we just made it turnkey. So contracts are in place, the infrastructure's in place, you just roll it out to your people. And so we can get a price to a company in about 2 days or less. We can enroll and get ID cards out in about a week. It's like very, very turnkey. Wow. And they get, I would say 90% of the bells and whistles of our typical, highly custom clients. And so now this can be rolled out across the country, and it's a wholesale channel for us.
So does that change the type of client and size of business?
It brings it down market significantly. Okay. So, right now our smallest company on Level Health is 9 employees, which is really small, for this type of program.
Yep.
But it works. And so, and most businesses out there are small businesses. Yeah. So now we have an affordable solution.
And roughly how many employees can they go up to?
This is really designed for what I would call the small to mid market, maybe 10 employees to 150 employees. And above that, there's a lot of, there's additional admin fees baked in that if you go above that threshold employee size, then we can do something more custom that's going to be more cost effective.
More on the Simpara side.
Exactly.
Got it.
Exactly.
From the spine. Okay.
Mm-hmm.
And you mentioned something too right before we started that you're also potentially bringing this, or maybe you already have, to the brokerage side.
That's right.
So if I'm a broker already in this space, I want a turnkey solution, because I've heard this from small business owners in the past that if they only have 15 employees,
right,
it's hard to get.
It's hard to get it. They don't have an HR director. They probably don't have a CFO.
And they're not going to grow. They're not trying to. Maybe they're in a manufacturing business,
right?
And they have no aspirations to grow to a 50 employee company.
That's right.
15. That's okay.
That's right.
But they also don't want something totally just off the shelf they want a little bit more customization, it sounds like maybe that could be good.
This is exactly what it's designed for. You nailed it.
But also available for brokers to now get all that.
So now
That's new, right?
It's brand new.
Okay.
So we just kind of entering this world of kind of the wholesale channel where brokers can sell what we've created. Another tool for them.
So you got the whole U.S., the whole states with brokers.
Yeah, it's exciting.
Where is Level Health here out of St. Louis too? But
It is.
aspirations to grow that across.
Yeah, I hope it gets really big. And we view this. It might sound silly, but we feel like healthcare is such a big problem in this country. We feel like we have a solution. So it's like, let's do as much good as we can to impact as many employees and families as we can. So it's kind of mission driven.
I love it.
Yeah.
Well, we get millions of people that watch every episode, so they'll hear that.
Love it.
Mission statement.
I love it. Millions.
What else should we know if we wrap up here? Like, I always do a call to action.
Yeah.
Again, if you're watching this has inspired you think you could potentially be a good fit to hear from Adam and his team, either on the Simpara side or the Level Health side. What would be the next action? Again, I said I'd include your information, but
yeah,
what's step one if you're watching this as a business owner? You think, I want to learn more about that.
That's right. So if you're a business owner and you're thinking, gosh, we've been struggling with healthcare costs, our benefits are getting worse every year, employees are complaining about it, we want to be innovative. It's as simple as finding our website, reaching out to us. It's that simple. It takes us very little information to give you pricing, so we try to make this really easy. And again, like 2 days or less, we can get you a quote. So
love it.
Yeah.
Love it. Anything else you need to know about the health insurance world, other than it can be fixed? Pretty messy, but it can be fixed.
It can be fixed.
Love it.
Yeah,
Love
it's
it.
hope.
Well, this is Adam Berkowitz, founder of Simpara Health, Level Health. Patrick Monahan, really appreciate you being here. This is super helpful. Hopefully it's inspired you. Again, I'll include the links for his information, but just really appreciate you being here, and we'll see you on the next episode. Thanks so much.
Thank you.